Thank you for trusting Dr. Broadbent and his team with your patient's care here at Oral and Maxillofacial Surgeons of Utah. When you arrived, you received this pamphlet of post-operative instructions. We are going to go over a few of those with you in this video. Our phone number is at the top. If you have any questions or concerns, there will always be a surgical staff member or a doctor who can help you. Unfortunately, every surgical procedure is partnered with pain. It is expected that the worst discomfort will occur 2 to 4 days after surgery. Your patient will receive a prescription for ibuprofen 600 milligrams, which they will take with extra strength over-the-counter Tylenol every 6 hours. It is important that your patient take the medication as instructed. Your doctor may prescribe pain medication that is a little bit stronger, and we will go over that with you today. It is expected that your patient will also experience some swelling and bruising after surgery. We've provided you with an ice pack in your recovery bag. Throw it in the freezer when you get home and then have your patient place it on the outside of their face for 20 minutes at a time for the next 48 hours. Another useful tip is to keep your patient's head elevated. Either prop them up on an extra pillow or have them sleep in a recliner after surgery. Bleeding is normal and can continue to ooze till tomorrow morning. Your patient will leave our office with gauze in their mouth, but that should be changed out every 45 minutes to an hour. When your patient changes their gauze, they will fold it into thirds and then roll it up. At that point, they can place it on the inside of their cheek towards the surgical site and bite down and apply gentle pressure for your patient's comfort. They will want to eat cool, soft foods for the first 24 hours. This includes things like ice cream, jello, smoothies, puddings, but avoid ones with seeds so they don't get caught in the extraction site. Later this evening, your patient can start to advance their diet to warmer but still soft. They will want to avoid things like bread and steamed vegetables that can get packed down into the surgical site. Your doctor recommends continuing the pureed diet for the first week to help avoid post-operative infection and food infection the day after surgery. Your patient may return to brushing their teeth, being cautious of those back surgical sites, as there may be sutures that will begin to dissolve and fall out on their own in the next 3 to 7 days. Your doctor will also prescribe an antimicrobial mouth rinse that your patient will begin using tomorrow and continue use for 1 week. To avoid dry socket, do not rinse, swish, or spit vigorously. If you are given this irrigation syringe in your recovery bag, your patient will begin use in 1 week. You will fill the syringe with warm salt water and place the tip into the extraction site to help irrigate and flush out any food or debris. Your patient will use the syringe 3 to 4 times a day and lessen as the surgical sites heal. After surgery, you will join your patient in the recovery area where we will be happy to answer any additional questions. We do not allow any pictures or videos to protect the safety of our staff, patients, and comply with HIPAA protocols.